it's good to hear from the wearer of the shoe, because there is a saying that the wearer of the shoe knows where it pinches most. So the lived experiences are critical in terms of designing interventions, because you get to hear exact kind of challenges they face, and many of the times they have solutions to whatever problems that they are facing. This way then we insist on closer consultation or working with the organizations of persons with disabilities, and these are organizations that are formed and managed by persons with disabilities, and they exist mainly to enhance their rights. So we have all kinds of organizations of people with varying disabilities, organizations of youth. We also have organizations of caregivers and parents. It is good to hear from them. Their voice needs to be heard and be integrated in whatever development decisions that we are coming up with. For the youth, very key, because they face many barriers in terms of accessing education. So it would be good to hear from individual youth as well as organizations, DPOs that represent youth with disabilities. To me, yes, true. We work with various partners, and I would say that what makes partnerships successful is a close consultation, talking to each other, having a dialogue, more so during the design of interventions, so that as we conceive projects, then people are talking at that design level, and like doing it during implementation. When you do this during the design stages, then you're able to incorporate the needs and the interest of the various partners in that kind of an arrangement, and factor them as you design your project in terms of work plans, in terms of budget, in terms of roles for each particular organization. And that way then, that kind of a consortia works very well, and it is effective in terms of delivery, where roles are clearly specified at the initial stages of a design of an intervention. We are saying that we need to move from our boardrooms. We have policies, we have laws, we have programs, but then we want to really touch the lives of children with disabilities, learners with disabilities, so that now we go to where they are and program and do work projects around now, having them go to schools and receive education. We also insist that there is need for more involvement again of persons with disabilities, mainly because as development partners, you're not able to do everything. You have a project, it has a starting date, it has an end date, but if you work closely with the DPOs in the areas that you are working, in the regions where you are working, then even after your project has ended, these disabled persons organizations will continue the work of lobbying to ensure that their governments are having programs to include persons with disabilities and promote education for children with disabilities. This is key, especially in terms of sustainability, because development partners cannot do programming forever in the various countries, but governments are there to stay, and they need to continuously, in their budgets, in their plans, include issues of persons with disabilities. And DPOs have a big responsibility to ensure that this is entrenched in our various governments. Number two, in terms of what we call social accountability, following the government to ensure that what they have promised, what they have budgeted for, is effective service delivery. So DPOs have the role to track what the government is implementing and to see to it that persons with disabilities are gaining in a meaningful way. Very key. And especially to people like us who are advocates, people like us who do lobby, who work closely with the government, and in our various propositions that we give to the government, whatever agenda that we are giving to the government, usually they ask us questions on, provide evidence, provide data on whatever idea that we want government to implement, and that is key. So if you are going to the government with an idea which is not supported by data or evidence, and then you ask for the evidence that you cannot provide, then it doesn't go. But if we do research and collect the data and produce evidence, table it to the government, many of our governments are willing to listen, and many of the times they have actually used that kind of evidence to design projects and programs. So evidence is key, and it is a prerequisite for effective lobby and advocacy. We need it more and more, and especially now that issues of persons with disabilities have been profiled. So what is required progressively is evidence to inform policy and program.